All
So,
right. Hi.
hi.
Yeah, so this is just a brief video, I guess, to introduce ourselves or reintroduce ourselves. We got a lot going on.
You go first.
Okay. I'm Stephanie. I am a registered nurse. I'm a board certified nurse coach, a functional nurse consultant, and I also kind of little dabble in some exercise. I'm a weightlifting coach, CrossFit coach, all that good stuff. Um, yeah, a little about me. I'm an ER nurse right now, but also have my own business with functional medicine, nutrition. I'm also a nutrition coach. Sorry, I forgot about that. Yeah. So, what about you?
So I'm actually going to hold it because I remember now. Hold it. You
Oh,
can hear it
okay.
better. So I am also a nurse. My specialties are in longevity, functional medicine, background in also emergency room.
Cool.
And I do a little bit of aesthetics as well. I have my own business here in Brookfield called Sola Wellness, where we do peptides, vitamin infusions, functional medicine, Botox. Yeah,
All that good stuff.
yeah.
Yeah. So I just kind of wanted to maybe do this interview and get together with you. We're kind of a rarity nowadays, but I feel like we're up and coming where we're nurses who are kind of expanding out of the typical traditional medicine and we're doing something different. And I feel like people may not truly understand what we do. So just trying to get the message out there of why we're passionate about what we do and also how we got in this type of this course here. So just I guess we can introduce how we met. Um, when did I guess
We met at work.
we did. I was trying to think when it was that I left. I went to the same day surgery center and you were per diem, you still are per diem. And we just kind of started talking about what we did and I had just kind of started getting my business up and going beyond the surface, health and wellness. And you were telling me about yours, and I was super impressed.
Thank you.
Just to see all you've accomplished, and you're still accomplishing, and will accomplish. So I think that's awesome. And then also, I just found out later that you were also in the ER. We were in the same ER. So
Isn't that crazy how
yeah,
kind of like it's tied in a little bit? I feel like ever since I got into the wellness space, I've just met people like people that you're meant to meet that
hmm
kind of think similar to you. They just kind of cross paths
yeah,
at the right time. So I think that was really cool that you were like, "Hey, I
yeah.
do this."
And you do that?
Yeah,
Oh, that's really
yeah.
cool. No, it was awesome. I'm so happy that we connected, and you're an inspiration to me also. So
Oh, thank you.
So yeah, so what got you? Yeah, I had a similar experience to you. Mine kind of came post COVID only because I started in the ER like spring of 2019. So worked all through COVID and then just saw the medical system implode on itself afterwards, where just all the deficiencies kind of came to head. Um, and I really saw like, and I see it even now, where PCP offices they don't have the time or capacity to treat their own patients, and so they send them to us. And we don't have the time or capacity, so we kind of shuffle them around to someone else, and it's just kind of so disheartening. Um, and I wanted people to have the time of day, and I wanted them to have the education that they needed and the resources that they needed to be able to get their proper care. Um, and again, just being in the ER, I found myself being so frustrated with the person and not with the system. And that wasn't the nurse that I wanted to be. I didn't want to be frustrated with people just because they couldn't get the help that they needed.
I feel like they get lost in the
Oh yeah.
system and then they get frustrated and then they don't want to do it
Nope.
anymore. So it's like you're in this cycle where you're not fixing the root cause and sometimes it can just be what they're eating,
So
how they're
simple.
sleeping, how they're moving.
Yeah, I was telling someone like I feel like 70 to 75% of people who come in with abdominal pain and chest pain, and it's like you talk to them and you hear what they ate, and I'm like, well, yeah,
Yep.
that's
Yeah.
yeah, that makes sense why your stomach and your chest hurts.
Yep.
But they don't know that, and what am I educating them on? Taking
Yeah.
an antacid and
For what? Yeah, yeah,
right,
yep. It's, don't get me wrong, like as nurses, I believe in pharmaceuticals when it's needed, but I don't think it needs to be the first thing,
right,
the first line of defense, right?
right,
There's other things you can do before going straight for the
yeah,
pharmaceuticals.
and then don't get frustrated with the person when they want to try something else.
Yep.
That's what I'm seeing also.
Yep.
So yeah, and in the interim, I had my own health issues. I was experiencing the same thing. And I came across a functional practitioner who still to this day is kind of like my mentor. She's been amazing. So she opened my eyes to like a whole nother avenue of medicine that I didn't know existed, and finding answers to my questions, my concerns, solutions, lasting solutions, feeling better, and like, oh wow, like I didn't need those medications at all, you know. So yeah, that changed my perspective, and that kind of led me down this road. And it's still, you know, ongoing. I'm kind of growing and figuring out how I want to grow and develop it. But I'm excited to be here and seeing what changes are coming down the road.
Yeah.
You can kind of just explain to everybody what you offer with your services.
So I offer vitamin infusions, vitamin injections, peptides. I do functional medicine. I do some aesthetic services like Botox. But pretty soon we're going to be growing into a new location and offering movement. So yoga, Pilates, meditation, sound bath classes. Just kind of a one location where you can, have all those things that can help you, not just physically, but just mentally and emotionally too.
Awesome. One-stop shop.
Yeah.
Yeah.
So that's coming real soon.
Awesome. That's good to hear. Yeah, kind of similar. I just go with more of like the nutrition route, functional medicine route. I still work full time. I work my 312s. So what I offer to people is, you know, people come to me with the issues, the healthcare issues, and again, they were seen by their provider, but they weren't provided the lifestyle portion of it, and also experimenting with, not I shouldn't say experimenting, but trying the natural supplements that also work in conjunction with the medicine. And everyone, I tell people, don't take medicine. Like you said, it can be an essential part of treatment, but also there's another route that we can try.
Yeah.
So, and also I've noticed that people need a lot of help with lifestyle changes.
Yeah.
They're hard to implement and to continue. So that's my role as a nurse coach, is to coach you through that.
And you've gotten the education. You're not just a social media influencer. You know what I mean? So it's different. We think a lot based on our education, how these supplements are interacting with your medication and what time of day, what foods are interacting with what also. So it's just, you're definitely much needed. And
trying.
Yeah.
So yeah, and I'm trying to, hopefully we'll see down the road in the next couple of months, integrate that into healthcare systems.
Yeah. Well, I think about when I worked in the ER and I wouldn't eat. I'd have my peanut butter and crackers and a ginger ale. Because you get a trauma coming in every 5 minutes.
Yeah. That's all you got.
It's something.
Yeah.
Where's my protein?
Yeah. Yeah.
So I feel like nurses don't take care of themselves while they're working.
No.
And it's not healthy, and it leads to burnout. And this is why we have such a big, huge, shift in where nurses are going into now. And that's why there's a lack of nurses.
Absolutely.
Good.
There's a lack of, people are being burned out quickly and are leaving the bedside, and we're trying to find something else, trying to find something different. I still have that love for the ER.
Well, because you're a caretaker, you're a caregiver. You can't get that out.
No.
That's part of you. And that's why you're in the field you're in too.
Right. But you also want that sense of satisfaction with your job.
Yeah.
And so that's why I also do this, because I wanted to help people get results and lasting changes, not just that.
A quick fix. Yeah. No.
So yeah, we have very similar paths.
Yeah.
And views on things. So I guess the last thing to ask is, this passion of yours, where do you see it going? Why do you keep going?
Where do I see it going? Well, that's a good question. I feel like I've integrated it well in my daily life. The changes I've made myself, I feel like that was the first step. And now integrating everything in my business and the way it's growing, the focus that I have now is on wellness and longevity. I'm only going to be this young, this healthy right now.
Yeah. You're your wellness business going?
Yeah.
Where would you like to be?
No, that was
That was
your
me?
turn.
Okay.
Yeah.
Yeah, we were talking earlier. I'm going to be going back to school. I'm still trying to navigate exactly how I want to fit that into what I'm doing now. But my true passion and goal is just to educate people, and also empower them to take care of their own health. Um, we talked about when I start working with someone, I tell them this is not forever. I want to give you the tools that you need to be able to eventually care for yourself on your own, advocate on your own. Simple things such as asking for lab work. I've had people, just tell me flat out, no, my doctor said no. Well, that doesn't matter. They can say whatever they want. There's certain obviously criteria with insurance, but there's nothing wrong with ordering this test and this test. And they're like, really? Yeah, nothing wrong with that. But they don't know. Um, we were talking about people come in the ER and they don't know what medications, or why you take them. So just empowering people to advocate for themselves, giving them the tools, and also just knowing how to do things naturally. You don't have to do this just because my doctor said this is it. This is the way to go.
And also, doctors are wrong.
Yeah.
They misdiagnose people a lot.
Yeah.
And sometimes, the way conventional medicine works is you meet this criteria and here's your medication, right? But if you can track certain things or prevent them from even getting there,
right.
I feel like that's where kind of our job is just to, like
fill in the gaps.
Yeah, exactly.
Fill in the gaps.
Because then there's the people that are on all these medications and all these issues that come from it. So it's just, I don't know.
And I tell people, like, this is not to talk bad about your doctor. It's just they don't know what they don't know.
Yeah.
If they weren't educated on it, they don't know how to teach you it, and that's just kind of.
Or if your doctor doesn't want to work with you, or is just not, dismissing all your symptoms.
Right.
Find a new doctor.
Right. It's okay.
Yeah.
You're not going to hurt them. Well, maybe you will, maybe you won't. Who cares? It's your health that you have to deal with.
That's the most important thing. I mean, if you're not taking care of your health, who's going to take care of it for you?
Right. So my inspiration is just seeing people grow stronger in their overall health. They may have come to me with one issue, but they were able to address another and another, and then their end result is so much better than the beginning. So I guess my role I see is an educator and a facilitator, and being able to help empower people. So that's where I want to see it go. A lot of other moving parts. I'd like to also empower my nurses.
Yeah.
We don't have to follow the traditional path and path of burnout at this point in time. So that's a real goal for me also.
Well, you think about why you started in healthcare, right?
Mm-hmm.
You wanted to help people, and working at a hospital is not the only way.
Right.
So I feel like the work we're doing is very intentional. It's difficult. It's time consuming. People don't really understand how much goes into formulating a specific protocol for them or a plan. But at the end of the day, if it's going to help somebody long term, I would do what I do for free. And that's what I feel like is when you have that passion for something, they can tell.
Yeah. And that investment in yourself, whatever it may be, financial, physical, mental, emotional, investing in yourself to be the healthiest version of yourself is so worth it. And it's such freedom. And I can speak from my own experience, coming from what I came from, that freedom of knowing, like, wow, like it depends on what I do. I know I feel better if I just do this, and this, and I do it, and there I am.
If I eat this way, if I move this way, if I sleep this way,
right?
So I'm the same way. And being a mom, like, I want to show up the best version of me for my kids and for my husband, because I know when I don't, I'm not a very patient person.
Yeah.
So
yeah, for sure. Well, cool. sounds like we're in alignment with a lot of things, and it's nice to just talk to like-minded individuals who have that same end goal
Yeah.
for people and for caring for people.
And I know you've talked about like women's health
Hmm.
a lot. I feel like I want to learn more about that.
Yeah, I love it. It's my passion. I think as women, as nurses and as women, take care of other people way, way more than we take care of ourselves.
Yeah, for sure.
Um, and so it's needed.
Yeah.
It's needed. So I would love to assist with that.
Yeah.
That'd be great.
All right.
Awesome.
We'll do something else like women related
Yeah.
soon.
Yeah, sounds good.
Hormones.
I'd love that.
Yeah.
Good stuff.
All right. Awesome.
Very cool.